So let's focus more on the idea of beauty. Really just understand what makes an Asian eye beautiful. I really believe today there's a convergence of beauty. I really like low brows. I like full brows. I think they're very beautiful in Caucasian, Hispanic women. But it's even more important in the Asian for one simple reason. If you lift the brow and cut too much fat out and you create a very high crease, even though it does exist in some Asians out there, it can potentially look very unnatural. And I'm going to show you some of those issues. In fact, I came up with a new way of looking at the aging Asian eyelid that may help you get out of trouble, even if you never do this double eyelid procedure. So what is beautiful? If you look, you heard Lena talk about, ¿qué es belleza? This is just a low crease, a full upper eyelid. That is what's beautiful in an Asian, something that preserves identity, not the old westernization in the past. Again, a very low, very full eyelid. For a primer, if there are any residents left in the room, essentially what the difference between an Asian and a Western eyelid, at least one that does not have an eyelid crease, is that the levator does not insert into the dermis. And that's why there's also a fuller eyelid contour, because since the levator does not insert, the postseptal fat can descend more and create a rounder contour, and therefore a narrower eyelid aperture. There are many techniques of addressing the Asian eyelid: suture, partial incision, or full incision. I've gone through really most of these here, but the full incision is really where I am today. I'll tell you why. The suture technique I really don't use because after 2 to 3 years it can go away. I had some great success with the partial incision technique. I don't use it anymore because I've had some failures. I use the full incision technique exclusively, and I'll tell you why. The partial incision I learned in Korea, and it's a great technique, but there are some limitations. It's harder to dissect through a narrow aperture, and I do this in 30 minutes. I don't need to save time, so to speak, and there's no reason for that. It does lead to less post-operative edema, so that's about the only benefit I can say. But because it's such a tenuous fixation, you've got to put permanent sutures in. So you're banking on those permanent sutures holding, which is something that I can't sleep with. With a full incision, they're temporary sutures. You put them in, you take them out in a week, and you've got a permanent fixation in almost every case. And a full incision allows me to modulate fat if I need to. I rarely take out fat now. I may take a little bit, but generally speaking, I just push it out of the way. As I said, I like a fuller fold. Okay, this is, I think, a fun topic. It's a topic that I came up with based on my experience, based on difficult situations. And it really is helpful if you deal with an Asian and you don't even want to do a crease. Like you never want to create a crease. That's okay. But you may encounter an East Asian in your practice, and now you've got to make a decision. How are you going to rejuvenate that eyelid? And let me help you out. The way that I've done this is I've classified it into 3 categories: without a crease, with a natural crease, and with a man-made crease. Why is this so important? Let's walk through this together. In fact, I just got a call from a colleague of mine out of Beverly Hills asking me what he should do, and I walked him through this algorithm. Essentially, I'm sorry there's so many words, but without a crease is a problem. If you go in there and you just take a little skin or take a little fat, let's say you just take some skin, because they're always born with a small eyelid, even if you take some skin, they're going to be unhappy. And where are you going to make your incision? I've seen incisions visible all over the place. So be very careful about that. The other thing is if you start getting into the postseptal tissues and take some fat, say, well, it's because it's a puffy eyelid, I got to take it out. And you don't create a crease. You may inadvertently create a crease. And the crease that you make is crappy. It's not a good crease. It's like a partial crease. And that's a problem. So the other thing is now, should you make a crease? That's a problem too. They don't want to change their look. So I offer my patients without a crease that are coming in, let's say 55, 60 years old, wanting some rejuvenation, 2 options. One, I create a crease, and I create it really low, so they barely can see it, but it will change their look, and I show them some examples of that. The other thing is I use fat grafting, which is amazing is that if I just balloon that upper eyelid out a little bit, I get some nice rejuvenation. How about a natural crease? This is probably the easiest. You think, well, Doc, I don't, you know, Sam, I don't need to hear your lecture. I know how to deal with it. Take some skin, maybe put some fat in, maybe lift a brow. But be careful, because if you just take skin, or you take skin and a brow lift, you really raise that crease. And if you raise the crease too much, you create an artificial result. You know, you can have a Caucasian with a pretty high crease, no big deal. That's okay. I don't particularly like the look, but it's okay. It can be natural. On an Asian, it can look totally fake. So what I usually do is if the crease is hanging over, the skin is hanging over the eyelid margin, I'll take some skin out. I rarely do brow lifts, as you heard, and I almost always put a little fat up there because I think it looks better. Okay, how about a man-made crease? Well, the problem is most of the Asians that are aging today had their creases done in the 1980s. The 1980s was a time of wild westernization, huge creases, skin taken out, fat taken out. And then you look at them, and now you say, well, Doc, I'm looking at this Asian eyelid and it's a low crease. I'm fine, let's take some skin out. Let's do a blepharoplasty. Problem, because oftentimes, over time, their crease, with brow ptosis, loss of fat, dramatic chalasis, the continued descent of that crease now overhangs it so they look like they have a small crease, but they don't. And the way, two things you can do to make sure, well, one, obviously just ask them. The other thing is look. You're going to see it. Something about their eye looks fake. You can't put it on, you can't put your finger on it. And the reason it's because that extra heavy, thick brow skin is folded over their eyelid, and it looks weird. That's why they have a low crease, but it still looks fake. Something about it, it doesn't look like natural skin. The other thing you can do is just lift their eyelid up. Look at how high their crease is. You go, oh my God, okay, maybe I shouldn't do anything. I would tell you be careful with the brow lift and be careful with skin removal. I would probably advocate nothing on the upper eyelid or a little bit of fat to push it further down. The only thing I want you to emphasize to you is that I like to using fat, make people slimmer. So Asians tend to have wider faces, and I take that fat and I draw everything forward. So I take what's called a brachycephalic or wide face and slim it down. And to me that's fun. I really like changing that look. One thing for a cultural issue, Koreans tend to have a very high outer cheekbone. Be careful of augmenting that. You know, what's funny is that we think a high cheekbone is a feminizing trait in America, or I'm sorry, in the West, but in the East, especially in Korea, they tend to think of it as a masculinizing attribute. So they do a lot of bony reductions to bring that cheek flare down. Fat in the nose doesn't work too well, but I do put some in there because it's so easy. And I do it if I start pushing into the nasojugal groove, because if you push into that area, you can wash out the bridge a bit if it's a very low bridge. The Chinese lady, I took a little skin from the upper eyelids, but you can see I push the brow back down with my fat. And at the same time, I've taken a wide face and narrowed it aesthetically using fat. So, in summary, just preserve ethnicity. Be mindful about the aging Asian eyelid I talked to you about. And, you know, I don't think most of you do silicone implants, but I've moved away from that. This is the book that I wrote, came out 2 years ago.